Hi everyone. Our presentation is on the research article Clinical Features and Potential Mechanisms Relating Neuropathological Biomarkers and Blood-Brain Barrier in Patients with Alzheimer's Disease and Hearing Loss. We are Emma Mills, Daniel Rader, and Chloe Shadle.
What is the theoretical framework? Alzheimer's disease is the most common neurodegenerative disease. It ranks at the top of all cognitive disorders as the most common neurodegenerative disease. Hearing loss is known as the most common aging symptom. Almost 25% of people over 60 suffer from hearing loss. This study pursues the idea that there is a difference between the cognitive functioning of participants with Alzheimer's and hearing loss, ADHL, and patients who have Alzheimer's but do not have hearing loss, ADNHL. The research question and hypothesis. Will the patients with ADHL have a greater cognitive impairment than the patients with Alzheimer's and no hearing loss, ADNHL? Hypothesis. Patients with Alzheimer's disease and hearing loss have greater cognitive impairments than patients with Alzheimer's disease but no hearing loss. There will be differences between the biomarkers and BBB factors of those with ADHL and those with ADNHL.
For this research, they gathered 65 Alzheimer's patients, divided them up by Alzheimer's with hearing loss and without hearing loss. They based hearing loss off of pure tone audiometry that is greater than or equal to 20 decibels. They then assessed cognitive domains by testing verbal memory with auditory verbal learning tests and complex figure tests for visual delayed memory. They correlated a low score with worse memory. Language was tested and concluding lower scores are correlated with lower language function. Attention was tested by the length it took each patient to complete the assessment. The longer it took was linked with higher attention deficit. Low scores on the executive function and visuospatial ability are also correlated with impairments to those areas. They then tested depression and anxiety, where scores greater than or equal to 8 were correlated with the presence of depression. Higher scores on the Cohen-Mansfield Agitation Inventory correlates with severe agitation. All the rating scales with higher scores were correlated with severe neuropsychiatric symptoms. They then collected 5 milliliters of cerebrospinal fluid from each patient and found levels of neuropathological biomarkers of Alzheimer's. The authors found that of 65 patients, only 21 had no hearing loss, and the remaining 44 did have hearing loss, suggesting that in patients with Alzheimer's, hearing loss is common. The cognitive function results data explain that patients with hearing loss had lower scores on memory, language, attention, and executive function tests compared to the group with no hearing loss. The neuropsychiatric symptoms results suggest that immediate and auditory memory in those with hearing loss was significantly lower and also affected language function and attention ability greatly. The biomarkers such as P2 are elevated in those with hearing loss. The findings mean that along with differences in the cognitive function, there are distinct differences between some of the AD biomarkers and the BBB factors of those with hearing loss and those without. They concluded that since hearing loss is common, auditory function should be tested early for Alzheimer's patients to be able to provide more information on slowing down the disease progression.
Real-world implications. The distinguishing biomarker and blood-brain barrier factor differences found in Alzheimer's with hearing loss may aid in the development of therapeutic drugs and general treatments for Alzheimer's. Hearing loss being identified early is crucial for patients with Alzheimer's, as it can lead to the acceleration of cognitive decline. The question that we would like to raise to the class is, do you think the results of this study would have been different if it observed individuals with Alzheimer's that were born deaf?